The method of vasectomy that I recommend to my patients is the no scalpel method of performing a sterilization for a man as a permanent form of contraception. I'm going to be explaining what's going to happen and what you're going to experience if you have this procedure. Usually a man will come into my procedure room and we'll have him lay on the exam table and we'll disrobe so that we can gain access to the scrotum. We also use some instruments during the procedure that are specific to this. So I'm just going to review that a little bit. We do use a local anesthetic called lidocaine. Some people have an allergy to lidocaine, and there's other things that we can do, but this is injected through a syringe into the area that will significantly reduce discomfort from the procedure. After that, we will cleanse the area of the scrotum either with betadine or some other antiseptic solution, and then we can begin the procedure. One of the instruments that we use is a ring forceps. This is a specific instrument that we use primarily only for no scalpel vasectomy, and this helps us to grasp the vas deferens and pull it out through a very small hole in the scrotum. And because of this, the procedure is much less invasive or painful. Another instrument that we use is a surgical clip applier. A surgical clip is a small titanium metal clip that looks like a small staple that can be used during the procedure to close off an opening in fascia, which is a tissue around the vas deferens, and it also helps with blood control. We also use a cautery device during the procedure, and I'll be going over that when I'm explaining the procedure. Now, during our counseling visit prior to having a procedure, I like to go over with a man and his partner how the procedure is performed and also to explain the steps that we take to achieve sterilization. This helps a man to understand what he's in for, but also to be able to help him to have confidence that after the procedure that we have a high success rate for sterilization. So what I usually will do is with my rudimentary drawing skills, I bring out a clipboard and draw a diagram of the scrotum and the testicles. The scrotum is a sac of skin underneath the penis that contains the testicles. There are two testicles, right and left, and there's also a epididymis and the tube that comes out from the testicle called the vas deferens. And this is the tube that we're going to be cutting and removing a section of that. So when the vas is grasped with the clamp, we can bring it out through the small hole, and a section of the tube is removed. What this achieves then is that we have separated the two ends of the vas. We can place this extra piece of the vas into formalin, and we can store that until after the procedure is performed in case there's any question about what was the tube that we removed. This can be sent to a pathologist later to confirm that this actually was the vas deferens. But what we achieve then is actually with three different actions, we're able to make sure that the tubes don't grow back together, what we call spontaneous reversal of vasectomy. So the tube section is removed. Also, we use a cautery device to cauterize the ends of the vas so that they are much less likely to grow back together again. Finally, we separate the two different tube sections from each other by a plane of tissue called the fascia. Now, the fascia is a tissue that will surround the vas, and when we grasp the tube and bring it up through that hole in the fascia, the tube is cut and cauterized, and then one of the tubes is allowed to fall back down, back into its normal place in the fascia. The other end of the tube is allowed to remain outside of the fascia, and the hole in the fascia is closed using a small titanium clip to close the hole. And this titanium clip just goes right outside and closes the opening in the fascia. So what we're left with is a tube that a section has been removed, the ends are cauterized, and they are separated from each other by this tissue called fascia.
Medtwice.com